This is Chris Ken with your Peak Fitness lower extremity stretch tests and fixes. All right, so when we're looking at the lower extremity, the first thing we're going to do is start out in a prone position and look at what we call heel to butt. All right, now once again, you can ask the client to simply flex their heel to their butt. It should come within several centimeters of the butt without the pelvis raising up. If we find that it's stiff and the client can't do it without the pelvis raising, okay, we know that this is a muscle that we want to stretch. And specifically, we're talking about the two hip flexors, both the psoas and what's called the rectus femoris, the front of the leg here. Okay, so we've got a couple options for this muscle, or for these muscles. All right, the first one is going to be called the couch pose, and once again, this is a great stretch that I stole from somebody smarter than myself. All we're going to do is just get the back leg up on the wall here. I just want to get my back knee pretty close to the wall. Kind of come into this position here. Just come upright. Hold in this position. I can kind of scoot away to make it a little easier. The key is that I'm feeling it here. I'm contracting the butt cheek of my down leg, and I'm just kind of moving around in this area to get a good stretch. I'm kind of looking for the area that's tight in particular. I can lean over a little bit more to bias the psoas, which will be a little bit higher. You'll feel that a little more in the stomach. I can lean back a little bit more to get the rectus femoris. But once again, the key is that you're tightening the butt cheek of the back leg. We're feeling it in the front of the leg versus anywhere else. Definitely not the low back. Decrease the intensity. This should not be, something that is hurting anyone. All right, now for our next option, we are going to have what is called a box hip flexor stretch. All right, and this is a little bit different in the sense we're actually going to put the foot up. For people with lower back problems, this stretch is a little bit easier and maybe a starter progression. All right, the key is that we have a box or something where we can get the knee above, or the foot above 90 degrees. I'll be right back. I'm just going to get a box real quick here. With this, what I'm looking to do, I'm just going to put my foot up here, lean in until I feel a good stretch here in the down leg. Once again, I can twist in, bias different areas by moving my body around, kind of side bending, get a little more psoas like that. You can twist in to get a little internal rotation. The key is to focus on where it's tight. Once again, tighten the butt cheek of the down leg. This is a great exercise, and again, it's a little bit less invasive. So putting the leg up on a countertop or something like that, very helpful. Now our third and final option, we also have what is called a Spider-Man stretch. Okay, with the Spider-Man stretch, I'm simply going to come into a Spider-Man position here, take my elbow, reach down to the ground, get my back leg off the ground, or you can stay on the ground, and just hold. And again, you rock around, look for the areas that are tight, straighten the back leg out behind you to kind of bias more the hip on the back leg. And those are our three options for that. Now, in terms of looking at the band, all right, we have what is called a band couch stretch. All right, with this, I'm just simply going to ask the client to put the band in their hip here, or around their back leg here. All right, I'm going to back up enough to where I get a good stretch. I'm going to come into this position here, and again, I'm just leaning forward until I'm feeling a stretch here. All right, to bias the rectus femoris, or the front of the leg, I can grab my back leg, or I can put my back leg on a step, and again, it's the same deal. Just want to make sure that I'm contracting my butt cheek, I'm moving around, and I'm back far enough to where I'm getting some good pressure into the stretch. All right, so that's what we're looking at for heel to butt. All right, now for internal external rotation, we can look at this in one of two ways. All right, first and foremost, we can ask the client to come onto their back here. We can move into external rotation. Again, it should be up around here, okay, or an internal rotation, and this is where I'm really lacking. I should be about 35 degrees out here. I'm right about there, so definitely something to make note of. We can compare it on the back here, or I'm sorry, on the stomach here. This would be external rotation. I should be able to get my my leg to my other leg here, and then internal rotation where I'm coming out this way. Again, the key is to watch the pelvis. If the pelvis is tipping up, or you see that moving around, that's where substitution occurs. So you can put your hand on the pelvis, on the client's low back to just kind of stabilize that area, or just watch to where it starts to lift up. All right, that's kind of the true range of motion. All right, in terms of what we're going to do for that, we'll start with external rotation. All right, the easiest stretch for external rotation, I guess the least invasive, would be just what's called a 90-90 pose. And this is simply crossing your leg like a man, coming into this position here, pressing down, holding. Again, you're going to feel a stretch here in the butt cheek, but again, this is pretty simple. You know, and again, just holding for 2 minutes. The next stretch, the progression would be a figure 4 pose. So I'm going to come onto a wall here. I'm going to get my leg into this cross position here. Once again, just kind of crossing down that way. What I can do here though is I can pull my leg back to really intensify the stretch, or I can come onto my toes. So this is more progressive. You know, and again, this is something where you might want to progress the person that is really tight from you know, seated to the floor. Our final one would be a pigeon pose, and with the pigeon pose, I'm going to cross my leg in front, get my back leg behind me. I want to hold on to my foot and make sure that my leg doesn't go back on me. Just kind of move around. It's a really good stretch. You'll find that, like I find that I'm tighter as I shift to the side, but you might find that by twisting your body in, moving back and forward, again, you just look for your tight areas, contract and relax the muscles in both front and back leg as you're doing so, and hold for 2 minutes on each side. All right. Now, for our band technique for external rotation, okay, this is called a band pigeon pose. All right, for the band pigeon pose, I'm gonna put the band around my leg. What I'm trying to do with this is get this thing to pull me laterally. So, come into this normal pigeon pose, but again, it's shifting me to the side, and again, it's just adding weight to the stretch. So I can do the same thing, just kind of move around, oscillate in this position. Okay, and that's what we're looking for, 2 minutes minimum. All right, now for internal rotation, we have a couple of options here. All right, number one is just what is called a knee-to-knee pull-in. Okay, with this, all I'm going to ask the client to do, come onto their back, pull their knees together, and hold. This is pretty simple. I can also stretch this on the wall by crossing my leg like a woman, kind of, and just pushing my leg in. You'll see that like I'm using this leg, I'll do it on this side so you can see me a little bit better, to pull my other leg kind of into internal rotation, and again, just holding. This is good for like when we have restriction on one side versus the other. But again, 2 minute hold, that's what we're looking at there. Let me see if we have anything else. Yeah, that's about it really. There's also the supine version where I'm on my back, and I just kind of let my legs go apart like this, try to keep the knees together. Really, any of those will work. Just kind of find the position that works for you. And that's what we're looking at for internal external rotation. Right now with our leg lift, we have just a supine leg lift where I ask the client to lie on their back, get their abs tight, raise their leg up. Again, when I do that, I'm looking at the other leg, whether or not it turns out or raises up. If we can't get up to 90 degrees right about here, or I see this down knee bend, all right, I want to apply some stretching to it, all right? And really the key thing here is that the other thing that I'm looking at is the down leg. So if I'm raising this up and I see the down leg turn out or raise up, I think I just said that, then again, we've run out of range of motion. With the hamstring, you want to be careful. Just because it's tight does not necessarily mean it's something that we want to stretch. I would always do glute activation work with the client and check it again, just to see whether or not the nervous system or other mechanisms in the body might be inhibiting it on purpose. That's something that we want to watch. So this is one where I would have caution. Feel the client's muscles. If they're really tight, they feel stiff, might be something you want to stretch, but always do glute activation first and be careful with this. All right, so first stretch that we can look at here is just what is called a wall leg lift. All right, with this, don't have a doorway available to me, but I can just put my leg up on a wall like this. I can also do what is called just a standing chair hamstring stretch. With this, what I want to do is just put my leg up on a chair, lean forward till I get a good stretch of my hamstring and twist in. I'll turn this way a little bit so you can see me a little bit better, but again, I'm here, leaning in, I'm feeling a good stretch here. I'm just twisting, and you can kind of twist in and twist out to hit that lateral hamstring and hit the inner kind of hamstring there, but that's what we're looking at there. All right, now, and from a band perspective, all right, we can get the band into the action here by simply kind of wrapping this around my call my grundle here, and this is just a band, we call this a runner's pose. So I come up and down like this, so I'm just kind of coming up and down. You can walk out, just kind of holding this this inchworm position here. This is also a good calf stretch, but again, you know, I can oscillate through or just hold just like that. So that's what we would be looking at with the band. And for our last, for our knee to chest, we're just kind of looking at the length of the psoas here. So with this, again, I'm just going to ask the client to pull their knee to their chest, hold, and come back. I should be able to get up to about 120 degrees if I can on, to where I see, you know, client's back arching. You know, this is something that I want to look at. Great position for this one would be the box hip flexor stretch, because we're getting up to 90 degrees. Again, lean forward, twist in, kind of move in and out of that area, oscillate, get that stretch going on. That would be one. The other one that we could also look at would be a long stance hip flexor pose. So rather than putting my foot up on a wall, all I'm going to do is just get longer in my stance, get very upright, lean forward till I feel a good stretch. Lean over like this. So I'm going to have my hand up, I'm going to lean over. You'll feel more of a stretch both in the leg and kind of in the stomach a little bit more, and that's what we're looking for. Psoas is up a little bit higher, so that's where we're looking to stretch. And again, 2-minute hold there. All right, so and again, with the as far as the band goes, we can use it in the same way. Really, the only modification I would make with this versus the first one that we did in this position would be, again, I want to get my legs a little bit longer, so I'm going to get a little longer in my stance, lean forward again, move over in this position, and you'll get a nice stretch. Again, stance is longer, and I want to hold for at least 2 minutes in that position. Now, for our last test here, we have dorsiflexion. Again, with dorsiflexion, I'm just going to get the client on their back. I'm going to ask them to flex their toes up. Again, you can kind of feel on them, see if they're pretty stiff, but they should be able to get back. They should be, you know, equal, and they should be able to get back at least 10 to 20 degrees. So if they're right up kind of at neutral, and you see the client's heels coming forward in their squat, etc., etc., it's definitely something that we want to look at. This is a very common one. Okay, so for stretching, we have two options here. Okay, first and foremost, I'm going to press my back leg into the ground and just hold. We want to do this both straight leg, where we're stretching gastroc, and soleus, where I'm bending my knee. All right, we can also do what is called shoe pose. With the shoe pose, I'm just going to put my foot up against the wall like this, lean forward so I'm getting a good stretch here. Again, I can kind of move around in this position a little bit better. The other one would be to bend my knee also and do the same thing. Okay, so 2 minutes minimum. That's what we're looking at there. As far as mobilization with the band goes, what I can actually do is put this around my ankle, come into this half kneeling position here. It's about to tip me over. Okay, just lean forward just by pushing my knee over my toe. Okay, this is a really good ankle mobilization. It's creating what is called some distraction in my ankle. And again, I can just kind of point my ankle in various directions here, oscillate over this spot. And again, just hold, either perform as a mobility drill or just hold for 2 minutes, trying to drive the knee out over the toe without letting the heel come off the ground. All right, so that's what we're looking at for our lower body. Apply the principles that we talked about with our corrective exercises, and get to work.